Hello there, welcome to Meridian Tonight.
The headlines where you are this Thursday evening. Is the health service in safe hands as the government plans major reforms? We put the health secretary on the spot as he tours our region.
We're going to give health professionals and patients much more control and an opportunity to shape services themselves.
Good evening to you. It's the biggest shake-up the health service has ever seen. Controversial reforms to scrap health authorities and hand control to GPs. They would then be in charge of multi-million-pound budgets and would decide how and where patients are treated.
The government has come under increasing pressure to drop the plans, but refuses to do so. In a moment, we'll hear from the Health Secretary, Andrew Langsley, who is visiting Winchester today.
First, Tom Savides looks at the reforms which will change the face of the NHS.
A big breath in and then a real blast into the meat.
Dr. John Ribchester is the type of GP the government wants to see more of. His practice is the fourth largest in England with 18 doctors. It offers services you would normally expect in a hospital, including a minor injuries unit, day surgery for things like cataract operations and a fracture clinic. The medical centre here, which has a multi-million-pound budget, is well placed for the reforms which puts GPs at the heart of the NHS. They and not health authorities would make key decisions on how their patients are cared for.
The GP is the person who's seeing the patient and also is the patient's advocate. So on that basis, then the GP should be a good person to do it. We hope that we can provide high quality general practice and continue to develop services that used to be delivered from hospitals in the community.
The NHS is facing its biggest shake-up in its 64-year history. The reforms would see strategic health authorities and primary care trusts abolished and more control handed to GPs, who would then become responsible for the provision of healthcare services for their patients. NHS hospitals would also be allowed to do more private work.
To listen.
The government has struggled to convince many NHS staff, like these at Frimley Park Hospital in Surrey, that the reforms are needed. Some fear its privatisation through the back door. Today, a protest was taking place outside the Royal Hampshire County Hospital in Winchester, as the Health Secretary Andrew Langsley was given a tour of the stroke unit inside.
The Health and Social Care Bill is the wrong prescription for the NHS at the wrong time. Andrew Langsley should drop it now before it's too late and listen to the calls of the public, patients, unions and professional organisations now.
The NHS reform bill has hit several stumbling blocks as it passes through Parliament, but the government is still pushing ahead. A bitter pill to swallow for many NHS staff. Tom Savides for Meridian Tonight.
Well, the Health Secretary, Andrew Langsley, was in upbeat mood during a visit to the south this afternoon.
He met NHS staff at the Royal Hampshire County Hospital in Winchester. Also there, our political correspondent, Phil Hornby.
We've spoken to lots of health professionals across our region. Some of them are in favour of your reforms, but most seem not to be. Why should people trust your views about the future of the health service more than they trust the views of all those doctors, those nurses, those midwives and so on?
Because actually one of the central things that the reforms will do is put decision-making about services for patients into the hands of doctors, nurses and health professionals. So that, for example, here in Winchester, I've been meeting the West Hampshire Clinical Commissioning Group. They, doctors and nurses, health professionals, will be taking responsibility for budgets. They'll be taking responsibility for designing services. General practices collectively are very well placed to understand what are the needs of their population.
I was with you just down the road from here a couple of years ago now when you launched these reforms and you started the argument. Why is it that almost 2 years on you still haven't won the argument?
Well, it's not an argument. It's actually a change that is happening already. In that sense, this is not an intellectual debate. It's a process that's already happening. All over the country, there are doctors and nurses who form these clinical commissioning groups. There are hospitals who are coming together in order to take Foundation Trust status to have greater autonomy. There are local authorities like Hampshire County Council who are setting up their Shadow Health and Wellbeing Board so they can shape the services for their patients in the future, so they can improve the public's health. It's not an argument, Phil, anymore. What it's about actually is legislation that will enable these things to happen in the future. And if you ask health professionals, are they in principle in favour of shaping services.
Yeah, but it's not being done in
themselves.
principle, is it? It's being done in practice, and they don't like the way it's being done in practice.
No, they're doing it in practice. The argument at Westminster, and of course they read the newspapers and they think, oh, there's all these things going to happen in legislation which aren't going to happen. It's not about privatisation. It won't lead to fragmentation. The legislation is absolutely clear about putting patients' interests at the heart of this, about a duty to improve quality, a duty to have services designed around patients, integrated around patients.